Good evening, everyone. Welcome to Optima Facebook Live. Elrigu Namaskara. As every time we take up any important medical topic and discuss with experts, I'm Dr. Vikram Jain, rheumatologist at Optima, and today to discuss about an important topic, fibromyalgia, which we started a discussion last time, we have with us eminent psychiatrist Dr. Thunga. She is a consultant at Optima, at Manoshanti, as well as Aster. Welcome, Dr. Thunga, and for taking time to address our questions about fibromyalgia. And today we'll be discussing a very important aspect of fibromyalgia. We last time discussed about what is fibromyalgia and what is likely cause, and very basic or very initial aspects of treatment. But today we'll be discussing about the uh, about from a viewpoint of from psychiatry. So without wasting much time, Dr. Tunga, fibromyalgia is something which still we are still understanding. There's a lot of research going on worldwide. We're still not very sure about what causes very definitively. We don't have any tests for fibromyalgia, and the treatment also is very varied, and different specialties approach it in different ways. But what common which we see in most of our patients who come with fibromyalgia, we know that most of patients are women, but there is always a component of anxiety, depression, commonly seen with fibromyalgia. I just wanted to start with: do you think that one causes the other, or do they share any common mechanisms? Anxiety, depression, and fibromyalgia, how are they related to each other?
Okay. So thank you, Dr. Vikram. So to start with, I'll go it with the very simple terms. So, like to give an example, whenever we fall or we get hurt, there's a teary eye, pain, crying. So, what we call it, all of these going hand in hand as a parallel mechanisms. So, even the anxiety per se might increase or the depression per se might increase the sensitivity to the pain, or probably the pain itself might cause the functional impairment and the depression and the factor. So they are, it's not that they cause each other, which could be what we talk about the common mechanism which go parallelly hand in hand is what.
It's like the chicken or the egg. Which comes first? Is it the anxiety, depression leading to fibromyalgia, or fibromyalgia, or it works both ways?
It works both ways.
Okay, sure. And how do we assess in these patients, in a patient comes to our clinic, how do we assess in simple terms these components of anxiety, depression in fibromyalgia? How in your practice, how do we approach this?
Okay. So anybody with a health issue was always apprehensive to know what is it, what's going on and everything. So what we have to keep in mind, fibromyalgia itself causes an impairment, a lot of impairment, and that itself will cause a severe anxiety. So even though they both cause or both could be the parallel factors, whenever a patient comes, you suspect a pain or a fibromyalgia, it's always well and good to rule out, except for the factor of the health related per se, what else the anxiety is on. So they usually tend to have anxiety all over rest other areas of life as well, and the factors of their functioning. So the not just the fibromyalgia will be causing a the functional impairment, the anxiety adding on to it will cause a functional impairment. So it depends on it all, it factors not just the health but the other areas of life also is where we look into.
Okay. All right. So we probably understand bit of fibromyalgia, saying that there is something called a central sensitization. They have an increased sensitivity to pain. Their pain volume is probably more. They have pain all over the body. But what really happens in the brain of a person of fibromyalgia? What is this central sensitization? Can you explain this in simple terms?
Yeah. So whenever there is a sense or for touch or anything, everything is goes to the brain and it's processed there, right? So to divide it into very easy things, what are the the areas of the brain involved and what are the chemical changes that happens. So the areas what will be involved is like, the sensory areas, the emotional part of the brain, which we call it as amygdala. And, there is an ANS system where we have locus coeruleus, all of these structures that involved. So whenever there is a sense like a pain, the way it sensitizes, the way it processes, that's where the signaling happens. But to put it across down how we sense it to externally, it happens through some chemical changes. Like, for example, we call happy chemical as a dopamine, and the serotonin which is present throughout. So all of these factors are decreased, which help in reducing the pain. But those which cause, like, we have certain chemical called glutamate which causes the pain. So everything, even though when it comes from a very external factor, everything is processed here. So the processing is where the there is dysregulation in that. So whenever we sense it, as it comes up, we feel it a lot. So there is, the pain processing is at the high intensity, but when you feel it, there is a reduced sensation that you should, from the brain where it passes the information that feel the pain less, it is not there. So that's where, to put it in the simple terms of the central sensitization is how it is.
Okay, so the patient's perception or uh, the brain processing of the pain is different in patients with fibromyalgia,
Yes.
isn't it?
Yes.
Yeah, and that leads on to this widespread pains. Um, yes. So now, when we talk about fibromyalgia, a very important component of fibromyalgia is, which is affected, is sleep. We now realize the importance of sleep, and the whole world is suffering of sleep deprivation because of social media and lights and so many other stress and stuff like that. We have forgotten how to sleep, and in fact we have to teach our patients that this is how we should be sleeping. That's the stage we are right now. uh, Now we also know that sleep is a very very important aspect to be addressed in fibromyalgia. How does poor sleep affect fibromyalgia symptoms, and what are the ways where patients can be helped to improve their sleep quality?
So, how, rather than talking about how does it help, how does poor sleep cause, considering all of us, even without fibromyalgia, even a poor sleep of us tend to make the day little, not that great, right? So imagine a person with pain who has not had a good sleep, the intensity itself seems to be more. And because all these poor sleep is also in relation to the central sensitization factor, which we discussed as of now, which is very important on. Just give me a minute. But yeah, meeting.
Yeah, so we're discussing with Dr. Tunga about sleep. Yeah, Dr. Tunga is back.
Sorry. So yeah, so with the poor sleep, what we are talking is where, for example, we have the serotonin which helps us to sleep, right? But the same thing will, if it's reduced in fibromyalgia, all same things tend to be reduced, so it won't help us in having a good sleep. So either the pain itself will cause a disturbed sleep, or the sleep itself will cause the increased intensity of pain, something which is very similar and which we all can relate to when we have a bad sleep. So when you asked about how we can, make our sleep way a little better with regard to this. So most of us do start doing, the first thing is I have to sleep early so that I can get up at my usual time. So that is where we started off very wrong. It's always to better to start stick to a wake up time first, and then probably you sleep by 9 or 11. It doesn't matter. Sticking to the wake up time is the first thing that we all have to start. Especially what I see with fibromyalgia patients is they say that I had couldn't sleep well, so I'm sleeping an hour extra. It doesn't matter if they sleep wake up at the same time or sleep an extra, it doesn't matter. So fixing the sleep wake up time is important. And also, to especially in an elderly, which when we come across, they always say compared to how they used to sleep before. So where we look into, or usually the better to sleep between, around maximum of 6 to 7 hours of good sleep is more than enough for us. So that is something which we have to also maintain and start maintaining the sleep schedule as well.
Yes. So sleep is there's some things called as sleep hygiene, where you have a fixed time to sleep, fixed time to get up, avoiding screen at least 1 hour before sleeping, as well as trying to have an early dinner at least 2 to 3 hours before you sleep, and also preparing for sleep. So sleep is something you just go into bed and sleep. You have to prepare yourself, dim down the lights, maybe read some book or listen to some music, avoid stimulating your brain. So these are some of the things, apart from Dr. Tunga has addressed, which will help to, and most important, having a fixed time to get up. So that will be very useful to sleep, to get a good sleep. And many patients with fibromyalgia, as you will be aware, will say that they don't sleep at all, or they sleep with as if they have one eye open. Even a small sound wakes them up, and they're like very hyper vigilant. They just get up even with a small sound, a small door opening or a small pin falling also would be a big thing for them. So that's very important. Sleep has to be set right. The first thing which has to be set right in fibromyalgia. Another important thing which people always say is that uh, what makes fibromyalgia worse, and of that very important factor is stress. And we live in a world where stress cannot be avoided. We are constantly under stress, of time stress or work stress or family stress. We are always under pressure, and that probably makes it, patients say that it makes their fibromyalgia pain worse. Is this correct? If yes, how do we manage, how do patients better manage stress?
So it is true, the fibromyalgia or the stress worsens the stress. So we all tend stress, but there's a simple ABC of a stress where we, be aware, we need to balance, and we need to control the stress. So which all most of the things is very simple factor which is there in our hand. So we need to be aware about what is causing the stress. So most of the patients you talk, they just say, no, I'm fine, no, everything, all, nothing causes stress, all, everything causes stress, but the specific something which causes a lot of stress. So being aware of what causes the stress, and knowing the balance, what can we handle, what we cannot handle. So we are in a race right now that, because somebody is doing this, I can also handle, I can also do this. We all can do everything, but we need to know how to balance it well. So that is something. And there's certain set of things that we can control as well. So controlling our scheduling. So most factor what I come across is difficulty in saying a no is where causes a lot of stress. So they tend to say yes and take a lot on self, and they tend to forget what they like, what they enjoyed. So probably scheduling well, time management, stop procrastinating things like, I'll do it later, and then everything is at once. And all of this stress, what happens, again similar, leading to the intensity, the perception to the intensity of everything tend to increase. The same which we, not just the pain, the mood factors, everything tend to increase with the stress.
Yes, very important point you said, that trying to do something which you like. And many times we see that women are commonly affected with fibromyalgia, and usually as they have under a lot of stress as homemakers, dealing with kids and elderly in-laws and parents and work, managing everything, and they probably don't spend time for themselves. And very, a very useful thing is for them to do something which they like, which they enjoy, which probably helps them to manage or feel better in control of their in the control of their time rather. Moving on, when should a person, suppose a person is diagnosed with fibromyalgia, when should he or she consult a psychiatrist? And if there is medications, is it only for depression or anxiety, or and does that help fibromyalgia also?
Yeah. So, I mean, this is something which I think we all discuss it when very common, like when to consult a psychiatrist is whenever they come across, because usually primarily they won't come to a psychiatrist. It's usually a pain specialist, rheumatologist, or a general physician. So once, when they come across that, they are diagnosed with fibromyalgia, so better to have a psychiatric consultation as well. So what happens, it's not necessarily we treat the depression, anxiety within pharmacological, but we can also, the without a drugs also, there is a treatment and the reassurance that can be given to them. So whenever they been primarily first time they get diagnosed, I think preferably that time is a better choice to get a consultation with the psychiatrist, which sometimes the underlying anxiety, depression cannot come up then. So, or, preparing them how things are going to go, how, helping them with some life skills and everything eventually will help them with when there is a primary psychiatric consultation. So that is my, in my experience, preferably at the first time when they get diagnosed with fibromyalgia. And you also spoke about the medications, like are they only to treat the depression or anxiety? No, there are certain medications which can take care of fibromyalgia as well as the anxiety and depression at the same time. So, for example, we have duloxetine, which takes care of both. So, there are certain medications which can take care of both in case of fibromyalgia.
Yeah, that's an important point, because many times in the practice we see that we diagnose somebody with fibromyalgia, they have depression, and they're already under treatment with the psychiatrist. So and we know these are special medications, there may be a lot of interactions, and many of them may be synergistic, maybe working together causing increased drowsiness or sleepiness or other factors. So how do we sort of any tips, I mean, to other doctors, like how can we deal with this situation when they're already on many medications and we want to start something for their fibromyalgia? Because as we know that many of them, as I said, there can be interactions, there can be a effect which is additive together.
So, one thing that what we can do is whatever the medications that they're on. So, let's just say the basic diabetic and hypertension that we come across. So, we need to look into the medications that they are there and the primary choice of medication, the psychiatric medications that we are planning to consider. So, extra other than that, if some medications which they're taking, if it is not necessary or if it was only for the pain management, like NSAIDs and all, so that can be slowly removed after slowly introducing a psychiatric medication and slowly withdrawn from the from their pain management, especially these NSAIDs. And also with regard to the not just drugs, there are many other medications which have come recently, like milnacipran also, which was I think few years ago it was given by approved by FDA. So that tends to have a lot of interactions in comparison with the duloxetine. So there are chances of interactions, but considering what they are on, so preferably which is safer for them is better.
Yes. So good coordination and communication between the primary physician or a rheumatologist, neurologist with the psychiatrist, I think would be very useful and helpful to prevent any adverse effects. Now we talked also about the non-medication or non-drug approaches, and one of them, which is part of the treatment, is cognitive behavioral therapy. What is your take on CBT? And others like mindfulness, relaxation techniques? and meditation in the management of fibromyalgia?
So I think they have shown a very promising improvement with the patients with fibromyalgia, especially with the CBT, which is cognitive behavioral therapy, especially for the you know the pain. And we would predominantly we do it for the insomnia, the sleep issues that I come across is where the CBT has been done in fibromyalgia patients. But also, the mindfulness is something which is very helpful, because to be it helps in knowing their pain factors. Nobody but a patient with fibromyalgia can judge the pain better. So mindfulness is something which is shown in, on continuous basis. It has shown to, the way the patient, sensitizes the pain has improved a lot. So promisingly, it has shown, but them stand alone has not given a very good improvement. But along with the, the medicational management and with the non-medicational, it has shown a very good, promising results.
One small doubt I had: the CBT is done by psychiatrists or psychologists? The psychologists are the primary people. How is am I right in that?
Yes, so psychologists are the primary people, but psychiatrists can also do a CBT, has been trained in
Okay,
how to do a CBT, but primarily, yes, a psychologist, but a psychiatrist can also.
can also. All right. Sure. Many patients with fibromyalgia complain that when their sleep is disturbed and they get up in the morning, they have difficulty in thinking, memory, concentration. They are not able to think clearly. They're not able to remember stuff. And this is a very major concern for many patients with fibromyalgia. Why does this happen, and can this be improved?
So what we call this as, the brain fog and kind of a fibromyalgia, right? So it is very common. And first, to answer the first question is why, when you ask. Our brain is in fibromyalgia, our sensitive part of the brain, the sensationals, the part of the brain is working very fast. So that is where the blood flow is going through, and whatever the, the executing factor or the concentration, where the front part of the brain, the prefrontal cortex that we call, so that is where the blood flow is reduced, and also certain set of neurochemical changes also happen there. So that's why the difficulty, when they wake up, the brain fog kind of a thing, difficulty in concentrating is what happens. So this itself will, again put them into like what to do next, and, and more focus on the pain factors. So they tend to, reach their goals as how they used to do it before. Like, I used to work for an hour, 2 hours, and now I can't do it. So how we can ask them or train them to do is, what is the maximum amount of time that you can concentrate on something? Let's just say you can do it for 15 minutes. So what we call it as chunking the tasks. We break them into small factors. You do it for 15 minutes, you take your 5 minutes out, and then get back to it. So breaking those larger tasks into smaller ones will help them, in concentrating better. And some people tell, oh, I don't understand where I left off, what I did. So, better to write it down so that, you know that where you start, where you're going to start next. And the breaks, what we take matters a lot. What kind of break? We are not going to take the break and go lie down because we are in pain. So the break can be used, just to take a small walk, even though the pain is there, rush around, or a small walk, or do something different than what they were doing. So those breaks will also help them to improve their, memory factor as well.
Sure. So we have last 5 minutes left. We have some audience questions before we take some get some take-home messages. Ravi asked, how can we distinguish between fibromyalgia symptoms and symptoms due to depression and anxiety?
So in the fibromyalgia patients, what they tend to do is the one is the areas of the pain that we look into, and also, how the onset has occurred. Usually the patients with anxiety and depression, you tend to, where you need to get back to, in the 5 years, 10 years down the lane. So when, which started on first. So usually what happens in case of an anxiety where the depression doesn't come out that often, but in case of an anxiety, there's always an apprehensive for the illness, right? So any small things of anything with the illness factor tend to, overwhelm a lot of things for them. So usually it's easier to help diagnose the primary anxiety in comparison to the depression, which is with the fibromyalgia. But preferably, usually we do look into the longitudinal factor and the longer run, how it is.
Okay. Yeah, Chitra is asking, can stress or emotional trauma trigger or worsen fibromyalgia symptoms? I think we discussed that. Yes, stress and emotional triggers can act as worsen fibromyalgia symptoms. Uh, Pramila asks, how can family members and caregivers better support someone living with fibromyalgia?
Yeah. So, see, most often than not, what happens initially, whenever a family member is sick, everybody is into it. So, once the patient starts throwing the mood factors, the family always tends to withdraw. That, they say that they don't want, the patient doesn't want us involved in the care and everything. So, what happens, because the pain is in a longer run, there is a burden and there's a burnout from the family side. So family also needs to know that they have to take the turns. They also need the breaks, and they also have the emotional overload. So we need to, rather than, ignoring the factor or leaving out of the, because of the burnout, when we withdraw from the care, that is somewhere, it worsens the factor. So being there, probably talking out, helping them in, keeping the schedule right, making sure about the sleep hygiene, helping them with the exercise and the regular appointments is something which from a family member can do. And also, even during the burnouts or during when it is a more on them, alternatingly taking turns and, taking break for the family member also is something which we can
Sure.
advise.
Absolutely. So we have last few minutes. We just want a few, if you, there are three key messages to someone who's newly diagnosed with fibromyalgia, what would these be?
So one thing is, whatever the pain that I am feeling is real, and it's always into the, there's always into the, the towards the negative factor that, it will worsen. Okay. Second thing is, we'll look into the minor improvements in the minor, the the win that you get in fibromyalgia. The minor improvements is something where which they can, help to focus on getting better. And whatever happens, the sleep schedule and exercise is often no compromise for a fibromyalgia patient.
Yes, perfect. I think fibromyalgia is real. That is a very, very important message, because a lot of times patients are the family members, friends, even doctors. Maybe sometimes we are also responsible to say that uh, you don't have anything, but this is real. Patients are suffering. They have widespread pains. They are having difficulty in sleeping and mental fog. So this has to be taken seriously, and you have to celebrate their wins, small victories. Obviously, we cannot expect dramatic improvements overnight. It's going to take some time with medication, exercise, sleep, and other things. And yes, sleep and exercise, absolutely no compromise. Very, very, very important, as mentioned by Dr. Thunga. Uh, yes, before we wrap up, one last question. Can fibromyalgia be cured, or it can only be managed?
So, as per the studies and in my experience, it can only be managed. So, as of now, there is no cure for fibromyalgia, but there is a lot of improvement with with all the kind of help that is required. Can only be managed. There will be flare-ups, but no cure.
Yeah, but the good thing is that we are getting better at it. We're getting better at understanding it. Yes, as Dr. Tunga said, because we still do not understand it completely, There's a lot of research going on worldwide, and people are really looking into trying to find ways to better management. And we are getting better by the year. What we did 10 years back, I think we are much better now. And if anyone of you or family members is probably suffering from widespread pains, difficulty in sleeping, has other issues, mental fog, fatigue, severe fatigue, please get in touch with your doctor, physician, rheumatologist, psychiatrist, a neurologist, and get it evaluated. And definitely those who have fibromyalgia can be helped, they can get better. And that is the very important take home, what we should, I think patients should take away. So with that, I think we will end our session. We are perfectly on time. Thank you, Dr. Thunga. Thank you for your time and your expertise in getting out the perspective from your perspective. Um, Thank you once again. Thank you for our audience for putting on the questions and listening to us patiently. We'll get in touch again next month, further discussing more about fibromyalgia. Thank you all. Good night.
Thank you.
Thank you.